Welcome back to Studious Students. In this video, we'll talk about enterobiasis, one of the most common helminthic infections seen worldwide, especially in children. We'll cover its causative agent, life cycle, clinical features, diagnosis, and treatment. With that, let's begin. Enterobiasis is caused by Enterobius vermicularis, commonly known as pinworm. It is one of the most common intestinal nematode infections and is particularly prevalent among children. The name pinworm comes from the characteristic appearance of the adult worm, which resembles a small white pin. Now that we know the causative organism, let's move on to its life cycle. The infection begins when embryonated eggs are ingested. These eggs are usually acquired from contaminated fingers, clothing, bed linens, toys, or other fomites. Poor hand hygiene greatly facilitates transmission. Apart from direct transmission, enterobiasis also has a unique method of maintaining infection through autoinfection. Autoinfection occurs in two ways. First is exogenous autoinfection, where scratching the itchy perineal region transfers eggs to the fingers and subsequently back to the mouth. Second is endogenous autoinfection, also called retroinfection, where larvae hatch near the perianal region and migrate back to the intestine. After entering the body, the parasite continues its development in the intestine. Once ingested, the eggs hatch in the small intestine. The larvae then migrate to the cecum where they mature into adult forms. The characteristic egg is plano-convex, meaning one side is flattened and the other is convex. After maturation and fertilization, the female worm begins its next important journey. Following fertilization, the gravid female migrates from the cecum towards the rectum and anal region. This migration usually occurs during the night when the host is asleep. The final stage of this life cycle occurs at the perineal region. The gravid female lays thousands of eggs on the perineal skin. Within a few hours, these eggs become embryonated and infective. At this point, the cycle can begin again through transmission or autoinfection. Now let's discuss how this infection presents clinically. The most important and characteristic symptom of enterobiasis is perineal pruritus or itching around the anus. The itching is usually worse at night because that is when the female worm migrates to lay eggs. Other symptoms may include abdominal pain, disturbed sleep, irritability, and weight loss. Continuous scratching can also contaminate the fingers and facilitate further spread of the infection. So, how do we confirm the diagnosis? Let's find out. The standard method for diagnosis is a cellophane tape test. A piece of transparent adhesive tape is applied to the perianal region, usually early in the morning before bathing. The tape is then mounted on a glass slide and examined microscopically for eggs. Another useful sampling method is NIH Swab technique. The NIH Swab is another method used to collect eggs from the perianal region. The collection specimen is examined under microscope to identify the characteristic X of Enterobius vermicularis. Once diagnosed, treatment is straightforward and highly effective. Treatment options include Mebendazole or Albendazole or Pyrantel Pamoate. Because reinfection is common, treatment of household contacts and maintenance of proper hygiene are equally important. Hand washing, trimming fingernails, and regular washing of clothes and bed linens help prevent reoccurrence. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Studio Students. See you in the next video.